According to Families USA in a 2016 research study, Hawaii will lose millions of dollars in federal Medicaid funding. Over the course of a year and a half alone, Medicaid expansion brought $599 million in federal dollars into the state's economy, affecting hospitals, other healthcare providers, and businesses. In my research of wanting to learn more about the poor access of healthcare for the low-income community, I specifically chose to volunteer at Queens Medical Center because not only that their mission fulfilled the need to provide a quality of healthcare service, but I also wanted to fulfill an inside experience of being in a healthcare facility to understand and know a little more about the interactions and engagement patients have with their physicians and doctors. In this volunteer program, it especially helped me to meet people who knows more about the aspects of healthcare in Hawaii.
They get a lot sicker. We do see a lot of folks that primarily, so to just target this geographic area here, we do see a lot of diabetes and obesity on this side of the island. And when we talk about how it affects people of low income, it's like I mentioned, it is the non-compliance. It's no matter how many attempts have been made to educate these folks, it's just a matter of, okay, when they leave the hospital, are they going to follow through?
The low-income people, actually it affects them a lot because it's expensive. Like some of the healthcare, they charge, I think, $350 for the PPO or less than that, but the minimum is $350 a month. You don't have any choice. As long as you work and as long as you become a regular employee of a company or any workplace and working at least 4 hours or more a day, the company will pay for your insurance, and a part of it you're gonna pay for it.
Oh, it's very important. I see a lot where folks, like how I mentioned earlier, folks come to the hospital when it's too late. They feel that with this whole Obamacare thing, I see resistance against that because they think it's taking their money. However, in the long run, look at the bigger picture. It's actually helping them. It helps them from accruing more debt. It helps them getting access to the appropriate services, whether it be establishing care with the primary care provider or with the behavioral health services and stuff like that.
It is very important because it is your health, and you cannot say when are you going to be sick. So once you have a health care, any time there is an emergency, once you reach the hospital, they're gonna ask first, it's not your name, what's your insurance.
In the conflict perspectives, this applies social inequality for groups having greater disabilities than the other. Sociologist Elliot Friedson argues that healthcare providers are assumed as superior to the patients as they are in control of the service that they need when ill. Karl Marx argues that capitalist societies like U.S. care more about maximizing profits than about health and safety of low-income people. In the functionalist perspective, sociologist Take Parson explained about the behavior required of people who are considered sick. This is the sick role in which refers to the social expectations about the attitudes and behaviors of a person viewed as being ill. Staying on sick leave dismantles the need for healthcare. Therefore, sickness is dysfunctional because it breaks your social stability. In the interactionist perspectives, interactionists observe that the nature of provider-patient contact can reduce the quality of care because of the inequality of healthcare treatment being played in role-based class and race. Good relationships between the healthcare provider and you maintain a stable, healthy status for yourself as the years go by. In the microanalysis, being in a low social class and economic status contributes factors like poor diet and stress because it leads to neglection of their health status when there is not enough money to pay for their healthcare services. In the mesoanalysis, healthcare promotes a healthy living population because of the Prepaid Healthcare Act that forces people to work and get a job in order to get healthcare benefits from their employers. If unemployment rate increases, more money in welfare from the government will be lost. In the macroanalysis, a sick role from the functionalist theory comes to play because low-income people in America are often blamed for their own poverty, illness, and unemployment. When the population of low income increases, With no access to healthcare, an epidemic of chronic diseases will rise. In conclusion, low-income people tend to have a harder time accessing healthcare plans because of high coverage costs and the lack of resources around them, which is the reason many people struggle on affordability and not relying on going to the hospital for regular checkups.